Hello all, very good morning. Hello all, very good morning. And now we'll see objective structured clinical examination. So in this objective structured clinical examination, it is a modern type of examination mainly used to assess this clinical skill, performance and competence. So what you are observing in this objective structured clinical examination, you are seeing the communication, you are seeing the clinical examination, you are seeing the medical and nursing procedure prescription, you are seeing the exercise prescription, you are seeing the joint mobilization techniques and interpretation of and interpretation of results. So these are some of the objective structured clinical examination. Objective structured clinical examination definition is, it is an assessment tool which is used in the components of clinical components such as history taking, physical examination, simple procedure, interpretation of lab results. So how you will there, what they are doing, they are displaying, they have done some clinical examination with the lab. Based on the lab results, you have to interpret, you have to bring the patient management problems, you have to do communication, you have to show your attitude over there, and all these things are tested using a grade checklist and rotating the student around a number of stages. And here what you are doing, you are rotating the student around a number of stations, some of which have observers with checklist. So in this objective structured clinical examination, what they will do, they will keep set of stations. So here in one station they will check what is the level of history technique. In one station they will check what is the physical examination techniques that you are using. In one station they will see what are all the simple procedures. In next station they will see interpretation of lab results. In next station means here the observers are sitting in a station wise. So what you have to do, you have to go from one station to another station, another station to another station. There the observer will have a checklist, and based on the things that you are performing, the observer will give marks for you. So here in this objective structured clinical examination, mainly the practical skills are assessed during the nursing, using this OSCE. So they will check the interpersonal skills as I have discussed. They'll check the history take, physical examination and mental examination, health assessment, decision making and clinical problem solving, interpretation of clinical findings, nextly management of clinical situations, patient education and acting safely in urgent clinical situation, and basic advanced nursing care procedure practice. So all these are the things that were assessed using this objective structured clinical examination. So in this objective clinical structured examination, as I'm saying, how they will organize means, here in this OSCE examination, it consists of nearly 10 to 15 stations. So each station requires about 4 to 5 minutes. When a student is passing through the stations, they have to spend about 4 to 5 minutes. So the number of students and time spent on each station may vary based on the need of evaluation. For example, if you want to take history taking, it will take some time. If you want to perform procedure, it will take more time compared to the history taking. And if the examiner wants to assess the communication, it will take some more time. So in such a way, here the station, based on the station, the time may vary. Based on the need of evaluation, the time may vary. So all stations, they should be capable of being completed in the same time. And the students are rotated throughout all students and have to move from next station at a signal. Means all students have to move to the next station at the signal. Means here what it is doing, when a person is completing one station work, again the person has to shift to another station. In such a way, all the students has to rotate from one station to another station. For example, if first person is starting at first station, he has to come to the second station, and second person will come to first, and the first person will come to second. So in such a way, you can see when he is sitting here, the examiner will observe him. From here he will come to here, and this person will come here. So it is like a rotatory manner. So this person will shift from here to here, and here from this station this person will come to this station. In such a way, the students are kept rotating. As the stations are generally independent, students can start at any procedure station and they can complete the cycle. As every station is independent, so as I have said, firstly the first person will come to second. In such a way, here the second person or the last person can start at the last station, and the first person can start at the first station, and middle person can start at the middle station, because everything is independent. But it is not possible all times, but sometimes you can go for different stations based on the need. But usually they will go step by step. So using 15 stations of 4 minutes each. 15 students can complete examination within 1 hour if they are going for independent stations. So in such a way they will organize this OSCE, means objective structured clinical examination. We have remaining points also. Each student is designed to test the competence of clinical competence, and at sometimes at procedure station student are given task to perform. They are given task to perform on the student or the patients, or sometimes simulators. So here the observers, they will check based on the agreed checklist, and they will keep the student rating scale, or they will give the marks based on their performance. And at other stations called response stations, students are responded to questions of objective type of, or interpret data, or record their findings of previous procedure stations. So these are some of the things that were involved in the OSCE. Coming to the advantages and disadvantages of this clinical examination. So here, more valid than the traditional approach of clinical examination. Examiner can decide in advance what is to be tested. Examiner can have better control on the content. It is more reliable, and the use of checklist by examiner, and the checklist can be used by the examination, and the checklist they can be used by the examiners. Coming to the disadvantages, student knowledge and skills are tested in the compartments. Here, demanding for both examiner and patients can be increased. Examiners are required to pay close attention to the students when they are repeating the same tasks. So here, whenever you are watching the same thing for twice or thrice, you will lose the interest. So for examiner, they has to pay close attention, and maintaining the same uniform difficulty at all time, it is not possible. So these are some of the disadvantages.